Hey everyone, it's me, Dr. Whimsy, and today I want to have a casual talk about adrenal fatigue. I get a lot of people contacting me who suspect that they have adrenal fatigue, and they want to know if I treat adrenal fatigue. Well, I want to start off by saying that if a person is suffering from exhaustion, there are a lot of reasons why a person might be suffering from exhaustion. So sometimes people contact me because they have chronic exhaustion, and so they say, okay, it must be adrenal fatigue. I need to contact a naturopathic doctor and be treated for adrenal fatigue. And so I want to clarify by saying, if you are concerned about chronic fatigue, we don't want to assume that the problem is due to adrenal dysfunction. So a person calls me, they have chronic fatigue, and we need to find out what is causing that chronic fatigue. The number one reason why people have chronic fatigue, particularly in Los Angeles, is due to physical exhaustion. They're just simply physically exhausted. Now, what are some of the causes of chronic physical exhaustion? Stress is absolutely number one. It's extremely expensive in Los Angeles. People are working 2, 3, 4 jobs. They're worried that they can't make their rent. So this chronic stress of living in Los Angeles can certainly wreak havoc on our adrenals and on our emotional well-being, and it's certainly top of the list when we're looking at chronic fatigue and exhaustion. Number one is stress. The second reason why we see chronic exhaustion is because people are simply not sleeping adequately. One of the things that we do when a person comes in and has an intake is I try to determine whether or not they're getting good quality sleep. Some of the risk factors for having inadequate sleep are simply not getting to bed early enough. Again, if you're stressing about your situation, it's going to be hard to close your eyes, relax, and get a solid 8 hours. Another reason might be drugs or alcohol that can be stimulating or can disrupt sleep. In the case of caffeine, you really want to make sure that you're drinking caffeine, that you're not having anything that has caffeine in it at least 8 hours prior to going to bed. In terms of alcohol, yes, you might be sleepy after consuming alcohol, but it doesn't necessarily mean you're going to get a good night's rest. So consider the fact that alcohol and drug use, even caffeine, maybe chocolate also, in addition to something like 1 or 2 glasses of alcohol, could be having an impact on sleep quality. A lumpy bed, not having the right mattress, having a partner that snores, all of those things can be a risk factor for having inadequate sleep. If you're spending too much time in front of computers or doing social media prior to bed, there have been some studies showing that the type of lights that come off of computers and off of cell phones can have an impact on brain health and on our ability to go to sleep. So again, that's going to affect sleep quality, and then you're going to wake up feeling tired and exhausted as if you didn't sleep that night. So if you do that over multiple days, you're going to be looking at chronic exhaustion and chronic fatigue. Another cause of chronic fatigue is anemia, malnutrition. Particularly if you're a woman and you're having a heavy menstrual cycle, you'll want to look at that. Or if you're skipping meals, eating disorders, or people that are not getting adequate nutrition might experience fatigue. And again, that's something that we see quite a bit of, unfortunately, here in Los Angeles. Another reason for chronic fatigue could be viral. If you are running a low-grade fever, or if you have a past history of getting an infection like mononucleosis or cytomegalovirus, any kind of chronic infection can also cause fatigue. So all of those things have to be taken into consideration before we tell someone that they are suffering from adrenal fatigue. Now, If we've done a good intake, then I probably can come up with some kind of a good treatment plan, but we're also going to want to run some labs. Some of the labs that we run are pretty much conventional labs, the same that any other doctor would run. We'd want to look at your blood. We want to look to find out if there's an infection going on. I would run a mono test to see if we're looking at mononucleosis, or do an intake to find out if there's a past history of any kind of exposure. Of course, you want to do a sleep intake, maybe send the patient out for a sleep study. Really want to make sure, as part of your treatment plan, that the patient is taking sleep seriously. Another thing I like to do with all of my patients is talk about the importance of meditation. Meditating twice a day, even if it's only for 20 minutes, is associated with creating relaxation, stabilizing cortisol levels, and helping with sleep in general. Particularly transcendental meditation, they've done quite a bit of studies. I think there's something like 300 studies, some of them quite valid, quite reputable studies that really show tremendous improvement in terms of stress levels and improvements in sleep. So what are some of the supplements that we use if a person is suffering from chronic fatigue? Well, in addition to making sure that they get a good night's sleep, that they're meditating, and they're eating a nutrient-dense diet, you can look at some of the Chinese formulas. Particularly, I like the herbal formulas that are called the Jing formulas, or the tonic herbs. Some of the ones that doctors go to are ginseng. Absolutely, it's considered a tonic or an adrenal or adaptogenic herb that can be quite helpful. Ginseng, I think, is one of the first things we go to, particularly students who are feeling fatigue and having difficulty concentrating. Another is ashwagandha. That's an herb that has a long history in traditional Indian or Ayurvedic medicine. Rhodiola, which is not only used for fatigue, but it's also good for balancing hormones in women. All right, so in addition to the herbs, B complexes, you want to take them in the coenzyme form, can be helpful. And if you're dealing with issues of chronic infection, some of the therapies that people have used, or IV therapy with vitamin C, glutathione has been found to be helpful, in addition to elderberry syrup and some of the other herbs that we think about for helping to build the immune system. In addition to the elderberry syrup, we've begun to look at studies on mushrooms. Some of the mushrooms that have been studied are the agaricus. The agaricus mushroom is interesting because the studies on agaricus focus on its ability to be antiviral. All right, so just off the top of my head, those are some quick remedies and the way that we look at the issue of fatigue and exhaustion from a naturopathic perspective. Okay, so if you are a minimalist like I am, if you are looking at minimalism in medicine, the first thing that a minimalist does, and this is part of the naturopathic medical view of treatment, is to treat the person as an individual and treat the cause. If the cause is not treated, then you cannot experience cure. So number one, treat the patient as an individual. And number two, treat the cause. So removing the cause, the thing that led to the problem in the first place. So identifying and treating the cause. We don't do aggressive or fad treatments in my office. That is just not what minimalism in medicine is. Minimalism in medicine is taking small steps every day that promote health. And so we treat the individual, we find the cause, and we use the most non-invasive, simplest treatments that are going to help promote wellness. That, in a nutshell, is minimalism in medicine. Okay, I want to thank you for watching this quick video. My name is Dr. Whimsy Anderson, and if you like this channel, be sure and share, like, subscribe, and tell me what you're doing to take care of yourself. I'd like to know. Thanks for watching. Take care. Bye-bye.